Brianna was a young black woman living in Boston. At 27, she was excited to become a mother. Brianna was a dedicated worker and had recently been promoted to manager. This brought new responsibilities and stress. Then, her husband lost his job due to COVID-related layoffs. Brianna had to work extra shifts, even though she suffered from pregnancy nausea. To make matters worse, her boss was not supportive of her pregnancy, which added pressure that weighed heavily on her. Throughout her pregnancy, Brianna faced challenges in accessing adequate health care. She experienced dismissive behavior from her obstetrician and felt judged for her financial constraints. She struggled to afford prenatal vitamins, and her concerns were often ignored. Tragically, at 27 weeks pregnant, Brianna collapsed at work due to overwhelming stress. Her baby, Marcus, was delivered via an emergency C-section. Sadly, Marcus died 3 days later. Brianna's story is heartbreaking. It highlights the disparate outcomes black women like her face. Her story underscores the urgent need for change. The impact of implicit bias on black infant mortality is alarming. A new study at the University of Ottawa found a strong correlation between implicit anti-black bias and increased infant mortality rates. States with higher implicit bias scores had much higher rates of black infant mortality. This effect persisted even after accounting for socio-economic factors, suggesting that bias itself plays a significant role in these disparities. Black infants are more likely to die before their first birthday than white infants. The reasons behind this disparity are complex, but we know biases lead to microaggressions and the effects accumulate over time. Implicit bias within the healthcare system is a factor. A study of 1.8 million births in Florida hospitals between 1992 and 2015 found that the mortality rate of black newborns was 3 times greater than white newborns. And the black infant mortality rate was reduced by half when the attending physician was black. Thus, we see the role of racism and discrimination in perpetuating these inequities. Addressing this issue requires a multifaceted approach, tackling both implicit bias within healthcare and the broader social determinants of health. Brianna's story and the stark statistics on black infant mortality are a call to action. Anti-bias training is essential for all healthcare providers. This training should be ongoing and integrated into medical education. We must diversify the healthcare workforce. Finally, we must listen to black mothers. Their voices and experiences are invaluable in guiding solutions. Every mother and child deserves unbiased care regardless of race or ethnicity. Let us honor the memory of little Marcus by working towards a future where such tragedies are no longer commonplace. Read the article in BMC Medical Ethics, Advancing Equity in Healthcare Systems, Understanding Implicit Bias and Infant Mortality. Thank you.